Good morning. We're talking with two outstanding geriatric care managers. We have two great guests today, one from Dallas, Texas, one all the way from Long Island, New York. First, I want to introduce Ann Markowitz Recht. She is a licensed social worker in the state of Texas, and she is a certified care manager in the National Academy of Certified Care. Ann has been helping people manage the healthcare system for their aging loved ones and family members, people with disabilities, for over 20 years. So welcome, Ann. Glad to have you on the show. And then I want to
Good morning.
introduce Julie Beasley. She is a geriatric care manager with a degree in gerontology. She's been working as a GCM for 5 years, but you've been in healthcare a long time,
Right.
working with
Yeah.
seniors.
Yeah.
So
Quite a long
thank
time.
you both for being my guests
course,
today.
thank you.
We're excited to have you. So we're
Thank
going to get
you.
started. Ann, what is a geriatric care manager?
Excellent question.
Right.
Short question, long answer. And that is somebody who is knowledgeable, has a skill set, has the experience, and at least a certification to help seniors and their families, as well as people with disabilities, to navigate the healthcare system, to do a good, complete assessment, setting goals, and help families or the senior meet those goals. In addition, ongoing care management, where you can be the advocate for the person, taking them to doctors, what I like to call staying ahead of the curve, not waiting till that, for that crisis, but avoiding the hospitalizations, avoiding the crises, and basically giving people the highest quality of life that they can have. And I think
Right.
everybody deserves that.
I
And
agree.
Joe, I'm sorry, you mentioned I was a licensed social worker in Dallas.
Oh, I did. I'm
Texas.
sorry.
No, it's okay.
Sorry.
All right. Just wanted to set that one straight.
Yeah, that's okay.
In New York. Apologize.
New York.
So sorry. So Julie, you tell us, you hear about GCM care, GCM management. Then there's a new subject, a new title called Aging Life Specialist.
Right.
So for the consumer, for the layman, the adult child, what is the difference? What is an aging life specialist?
Well, I think that the term geriatric care management, I think a few years ago, and you probably even know this more than me, I think they actually started discussing that term. Geriatric care management maybe didn't cover kind of all of the different people that we can help. So I think they wanted to come up with a word that was more, that served more than just a geriatric person. So I think that is why they, decided to change the name to an aging life professional or aging life specialist. So
Right.
that was my understanding.
Yeah. So to clarify, the they is the National Association.
Yes.
Which is always good if you hire a care manager to make sure they belong to that.
Right.
So it used to be called the National Association of Professional Geriatric Care Managers. And Julie's right, they did want to expand that reach to Aging Life Care Association. Right. The other issue was care management could not be trademarked. So they wanted to make something special, different,
Right.
trademarked. But you're right, and also to expand that reach.
So tell me how you got there. Tell me about your walk in the senior care industry and how you became a geriatric care manager.
Okay, again, a long answer. It's been a journey, an interesting one. I was in public relations and marketing, my first career, and I worked for a Jewish community center with a wonderful mentor who encouraged a master's in social work, which I did. And then I went on to be a director of a guardianship program in New York on Long Island. And that forayed me into the care management space. I had my own company for 16 years as care management and companion services, serving the New York metropolitan area, and recently was acquired by Caring People in just January. And I'm the director of care management, as you said, for Caring People.
Okay, great. And we're with Acappella. We are part of Caring People too. It's so exciting in this transition.
Yeah,
It's real
very.
exciting times. So, Julie, walk us through how you wound up becoming a geriatric care manager.
Well, I think my first, when I graduated from college, I started working in facilities and assisted living communities, independent living communities, more in a sales role. And but as we all know, kind of sales roles can sometimes take on that, where you're walking families through, kind of the whole process of, what the right decision is for their loved one. And I actually just interacted with several geriatric care managers that are still, that still practice today. So I think it just really inspired me, and I saw what they were doing, and I just knew it was something. I really didn't know exactly how to get certified, and kind of what the requirements were, but I knew that once I kind of found out more about how to do that, and then I started working for Acappella, Joe, and just wanted to take that next step, and so I ended up going through the whole process, and here we are today.
And
So
at Acappella, we were your mentor,
Right,
and I'm
absolutely,
an RN. So,
yeah.
and it's interesting. I really want to go through that training
Yeah,
also,
definitely.
because I feel in private duty and home care, we are meeting with families. Anybody that truly cares about that client and
Right.
wants their outcome to succeed, the more knowledge you have, the better. And, there are a lot of questions families will ask me that I don't know all the
Yeah.
answers.
Yeah,
But
we
just
don't, yeah.
knowing those resources, and hats off to both of you because you have a really tough job. You work with some very difficult, challenging clients, some wonderful, loving clients too, but there are some hard scenarios. One example, and we talked about this the other day, and I know, Julie, we've dealt with these. What do you do about a family that hires you as their geriatric care manager because the family has 6 children, 3 want palliative care, 3 want aggressive care done? So what do you do? So tell me how you would handle that family.
Yeah, we've had many situations like that. Look, not everybody's going to be on the same page, and that calls for mediation in a way, a family meeting. We've got a couple going on right now, and my team, one of my care managers, is probably on the phone with just these 3 daughters once or twice a week, dealing with the ongoing situation with the parents. But it's first of all, everybody has to agree, just like in a regular mediation. We trust, whether it's Ann Recht or Julie Beasley, we trust her, even if they're on different sides, so to
Right,
speak.
absolutely.
It's an education process, and talking through what their feelings are, why they feel that way. Why does son number 2 want the aggressive procedures, but daughter number 3 doesn't? Where does that come from? What are their feelings about it? And it's kind of a part support group, part mediation of talking things through. And I never want to be the decision maker. I'm just getting them to talk about how they feel, why they feel that way, coming to some understanding, and offering some options.
And also, I think it's important just to always take the family back to, what would your mom want? And really focusing
Absolutely.
on, I am the advocate for this client, and yes, I want to help the family as well, and, try to mediate and come to the best decision. But I think that is probably the number one goal in geriatric care management is what does the client want? What would be their wishes? And, maybe they can't express them, but getting that feedback from the family, the sons and daughters, or if they can't express them, then, just taking it back to the client and what their wishes are.
I agree 1,000%. And when wishes are known, whether it's
Right.
written in a healthcare proxy or
Exactly.
discussed, it's great. But and this is a great plug for people to have these discussions,
Right.
especially
Definitely.
going through COVID now. And, this situation is real for a lot of people, and this
Yes.
should be done anyway. What do you want? What kind of measures? What does death look like? And unfortunately, it's not done enough. So you have people siblings and children sitting around a room and not knowing,
Not know. Yeah,
or disagreeing
exactly.
with what the parent may want, which
Right.
is even worse. But which is why it's so important. And as you said, it does go back to the person. Absolutely.
Right.
It does. And I remember, I know as a nurse when I meet with families too, and I'm not a geriatric care manager, but I would always say 10 years ago,
Right.
envision having a cup of coffee with dad
Exactly.
and you have this conversation. Your healthy dad 10 years ago, what would he
want?
say?
Right.
What would he want? And they always say, wow, you're right.
Yeah.
He would not want to live like this. And, and just working together, put things in perspective,
Right.
So my next question for you guys, and we all have memorable clients. We all do. I have some, like every year, I always have that one client that just pulls at my heartstrings and makes a difference in my life. You always learn from our clients. I do. I know Julie met with a family the other day. I talked with them on the phone. I mean, she's like, Joe, these are the sweetest people. And these people are so lonesome with COVID. There's so much uncertainty, and just being at their side and being a listening ear, it's so rewarding. For me, I know for you guys too. I can just tell. I don't know you, Ann, yet, but I can tell you just have a heart for those seniors. So tell me, I want you both to share your most amazing story or something that one of those that you will always remember. So Julie, you go first.
Oh gosh, this is a hard one. I would say probably the one that sticks out to me is, it may not be. It was a situation where we did have a son and daughter that just did not see eye to eye at all. They hired me to, just kind of help through this process and kind of meet with their mom, which I did once a week. And we were providing round the clock nurses for this client. I loved her, the client herself, and just learning about her. She had a really cool story. She was actually, her best friend was, what's her name? Ruth Ginsburg.
Oh, the judge.
Yeah, the
Oh,
judge.
wow.
Am I saying that right?
Supreme Court.
Yeah, right. So anyway, and so we just had a lot of great conversations, and but her son and daughter were just at odds, and I think a lot of it was financial, which was, we see that a lot, which is sad.
Yep.
I think they were looking at kind of the wrong perspective long term, but they just were at odds with each other, and so I would have just meaningful conversations with the daughter and the son, and really try to just help them. Again, like Joe said, put it in perspective. Like this is your mom, and all of this is, when she's gone one day, what do you want to do? You want that feeling of, I did everything I could to give her the best care, and I also think it's hard when a client sees their children fighting. I think that's so sad.
Sure.
It happens. So I think it was just rewarding because I think the son felt like I was really on his team, and I was really on his mom's team. I was really fighting for her, being an advocate for her, but also just encouraging him along the way. And so, I can think of a zillion that kind of just popped in my head.
Right.
Just how we walk people through this difficult process, and it can be long days, and I'm sure you're familiar with those long days. But it's at the end of the day, it's like it's so rewarding, and you did something really to help someone. So that would be my story. What about you, Anne?
Well, I totally agree with you. And the family dynamic is something we deal with all the time.
Yeah.
Cutting through the, mom like you best kind of thing. But my most memorable happened a few years ago, and it was a father and son in Queens. And the son was a Vietnam vet,
Uh-huh.
and for lack of a better way of putting this, he just went crazy one day or one night. So the ambulance came, took them both to the hospital. The hospital had them in, depends, and the father in a wheelchair.
Oh.
And they were, the hospital went for guardianship, and, thank goodness the guardian saw. I mean, there was assets, there was money to spend. He could have put them both in a nursing home, which would have gladly taken them, but he called on us, and we were able to bring them both home. We were looking into ramps because the father was in a wheelchair, but by the time when they did get home, the ramp took a while. We got physical therapy in, and he didn't need the wheelchair. We got them both out of the depends. We got them a male aide, home health aide, and who took them to ball games, Mets games.
Aw.
We danced with them, and unfortunately, they're both gone. But for years, they had a quality of life that, if not for us, they would not have. They would have been both in a nursing home, and the son was maybe in his 50s at the time, and dad
Right.
was, nearing 80, give or take, when we started. We had the case a long time, and like I said before, it's providing a higher quality of life. We didn't have the family dynamic in this particular case, which made it a little bit easier, or different. But we still had obstacles, and there was a
Sure.
lot of work to be done. But Julie, like you said, I sleep well at night,
Yeah,
and
absolutely.
I'm just I can't think of a better way to spend days. Yes, you're right. Some nights and some weekends,
Yeah, right.
but to have that and so many others. We could go on and on, and
Yeah, that's so true.
talk about the cases, but we do improve people's lives.
Absolutely.
Well, yeah, and I think about, my own dad was in the hospital, was sent to a rehab, and he called me one afternoon and just to say hi and see how he's doing. Well, he needed to use the restroom. He said, "Joe, I've got to go to the bathroom." And I said, "Well, just push the button, Dad. Somebody will come in
Magic button.
and push the button." And I heard the attendant from the hall, "Just go in your pants." My dad said, "I've got to
Wow.
go to the bathroom." And so I knew immediately I needed to go into GCM mode. You're in rehab. You're supposed to rehab my dad.
Right.
But I'm a healthcare professional, so I know the ins and outs. We
Yes.
all do. So tell me, as far as you've got a client that really needs an advocate, that maybe they're going through chemo or radiation, the daughter lives far away, they've got to get to the doctor, they want a good report. So tell me, as far as cost, a lot of people assume that GCM services are just astronomical and only the wealthiest of wealthy can afford it. What happens to that individual like that? They've got a little money saved, they need someone to be an advocate. Talk about costs just briefly on that, what it would cost a family.
Right.
Well, I mean, I think it varies. I mean, I think,
Yeah.
but I think the great thing about it is that you can, families can do very little. I mean, they can do maybe just if they just need an assessment, and then maybe they need just 1 hour a week for a month or so, where they're having maybe doctor's appointments and they need, a care manager to take their mom. So I think it can be, we have clients that would need us, a few times a week, and then, more conversations with the adult child in, California or wherever. So all of that, obviously, we charge for those services, but I do think it can be, if people just kind of need it, okay, I just need your your advice and your consultation on this kind of situation. So I think it can be, it doesn't have to be crazy expensive for everybody, and people can just use it just on a short-term basis. So, what is your thought, Anne, on
Yeah,
the whole
I agree with
cost?
you. I mean, look, cost is always a
Yeah, it's always a
factor
factor.
in anything, and especially when you're dealing with a service.
Right.
Um, I talk about the cost effectiveness, the
Uh-huh.
benefit that families will get. But to answer the hard question, I would say throughout the country, it's anywhere from $125 an hour to 250, and people will go a little bit above that and a little bit below that, but that's pretty much the range. And then we can talk to the individual client, like Julie said, what are the needs? So
Right.
what are the needs? And we could figure out around how many hours that would take per
Sure.
month. Cases come, they're kind of heavy in the beginning, and then the idea is to put in the interventions and the
Right.
resources to make it easier for everybody. And then it's on a maintenance of maybe visiting twice a month, or, we have a just checking program for the well senior who are doing okay, but need a check-in
Yeah.
once a month. We'll visit and then call twice a month to make sure that things are still
Oh, that's
going
good.
well.
Yeah.
And we know enough, we have the knowledge, the expertise to understand little changes that may cause some kind of avalanche in the near future. And we'll be able to stop those.
Yes.
So for people that do need the care management, it's cost effective. We're dealing with people's lives, their quality of
Right.
life, dealing with the healthcare system, getting the right information from doctors, like you just said.
And it's peace of mind too, I think.
Yeah,
For,
it is.
you know,
And I've had patients, I've been in their home and they get a bill from Medicare, and it doesn't mean they've got to pay that bill.
Yeah.
But even for me, when I look at certain things, I'm confused, and I'm an RN in healthcare. So I think just, the old expression, people, step over a dollar to save a nickel. Sometimes the cost of that GCM service
Yeah.
far outweighs benefits
Right.
the outcome. So, just doing your homework, and you may say, if somebody says, all I can afford is 5 hours a
Right.
month of geriatric care management. So is that an option?
Yeah, absolutely. Yeah, for sure. I think it's
Unless they really need
customized.
to.
Unless they need 10. That's right. That's right.
Right.
I know. And some do. Okay, so we're going to talk about, this has been so interesting. Tell me about how you're dealing with COVID as geriatric care managers. So what's been going on for you guys, and has this been stressful?
Oh, I think definitely it's been stressful. I mean, I think it's just, it's unbelievable. I think that's what, I was with a client yesterday and they're just, he was like, I can't even believe this is happening. I think people are just still kind of in shock almost. So I think it's really just, honestly, it's been stressful for sure, but I think it's honestly helped, the business that we're in, just because, people are reaching out more and just needing, what do I do? What do I do with my mom? I mean, she's at home and she, is someone checking on her? As far as caregivers go, are they, just making sure caregivers are being safe, and, all of those things that we're having to kind of navigate that we haven't really had to before. So, I mean, I think it's just, I think it's only going to actually help our business, and because I think people are just going to need it all the more. They're going to need answers to, questions that we're not familiar with, and so I think we're all just trying to work together and finding that, the best way to get through this whole crazy time that we're in. So.
Yeah, I definitely agree. I think people staying in place, not being able to see their parents or aunts or whoever they're caring for
Yeah.
in another state has definitely increased our need. It's taken us, like everybody else, on the technology route. Telehealth medicine, we're part
Yeah.
of the doctor's screening of our clients or visits.
Yeah.
Telehealth, we're doing that. We're doing a lot of FaceTime, Zoom meetings with not only clients, again, families. We're starting to go out to see our clients who are in their homes, depending on the situation.
Right.
So, and
We're
work
meeting
out with
outside a
Swift.
lot, a little bit. So,
Outside,
yeah.
thank goodness we have nice weather now.
Yeah. Right.
Wanted to get, but actually, I just got a call from someone in Florida, and I may do. We don't have Florida Care Management yet, but I may do a Zoom assessment
Okay.
through a long-term care insurance company, which never would have been considered, right, before COVID. But
Right.
now, with everything being like this, I'm not going to do this on a long-term basis, but until we start our team down there, it's a good option for sure. So a lot of telehealth, and I think people reaching out more because they can't see, and of course the effects of the unfortunately the long-term care facilities of nursing homes and assisted livings that COVID is having on our clients and our population is.
Are you seeing a lot of people being pulled out of those places, Anne?
Yes.
And yeah,
Yes,
we
that is starting
same
to
thing.
happen.
Yeah, which is
Absolutely.
yeah. I think people are just taking that, just not wanting to take that risk of having their loved one in, a community. So we are seeing a big, impact from that.
Yeah, and just in the communities, they're having to stay in their room. So the whole purpose of moving to an assisted living or an independent living is to have that social factor, that social
Yeah,
relationship, and
right.
they can't do that
Can't
right
do it,
now.
right.
And so, a lot of times it is better to be at home, but the daughter may still work, or
right.
the daughter's got to homeschool her kids. So that's where home care and geriatric care managers can help so much in that transition. And we have seen such an increase in that.
Yeah.
And I get it, totally.
Yeah,
I get it. It would be
absolutely.
very hard to have a family member in a community that you couldn't
you couldn't see,
or talk to, or, but they are being a lot more, trying to do things to allow that communication.
Yeah, definitely.
So, Anne, how can someone get in touch with you in your area if they are needing geriatric care management or they think they might benefit from using your services?
Sure. I'll give you, I guess, the local number. It's 516-605-0434. And again, we're covering like a New York metropolitan area, Connecticut, parts of Connecticut, Hartford, lower part. And we're going to be in New Jersey and hopefully Florida
And Texas.
already in
Texas,
Yep.
I know.
Yeah.
And what about
Yeah.
you, Julie? How can
Well,
we get in touch with Julie?
you can also, I think you're listed on the Aging Life Care website as well, Anne. So
Yes.
I am also, we're both on there. And then as far as just my own phone number, it's 469-855-6266. And we cover all of kind of Dallas and Fort Worth. We cover 13 counties.
So if we have a listener
Yeah.
who's in Detroit, Michigan, and really feels their parents would benefit from a geriatric care manager, could you all point them in the right direction?
Yeah, absolutely.
Absolutely. Yes.
For sure.
I'm actually the president of New York's ALCA
You're the chapter. Aren't you the chapter president or?
Yeah, chapter
Yeah.
president.
Right. Okay.
That's all. So I know a lot of people throughout the country and can definitely point anyone in the right direction that we don't cover.
Well, we have loved this. This has been so interesting. Thank you, Anne, for your time.
Yes, it was awesome.
Thank you for
Thank you
serving
so
our
much.
wonderful seniors, and Julie too. And I haven't worked with you like we will in the future, but just
Yeah.
working with Julie, I can just vouch and say she has made such a difference in our clients' lives, and we're just so grateful for your service, and thank you.
Well, thank you,
And
guys.
you guys have a great weekend.
Awesome.
So
Thank you, Anne. Talk to you
Take care,
soon. Okay. Bye.
Okay.